Welcome back to part 2 of the Women's Health Lecture. So this time we're going to go through infections for part 2, looking at vaginal thrush, bacterial vaginosis and cystitis as the main parts of it. And this will be useful for you, not only thinking about giving advice in the community pharmacies and looking for the right treatments for patients, but also because you're going to end up with some lovely exams on this. Your OSCEs in particular would possibly contain scenarios where you'll have to deal with patients, and it's really common for patients to come in and ask about these problems. So firstly, looking at thrush or candidiasis. So thrush is a lovely bird for all those ornithologists of you out there, and I don't know why they've used that name, but that's the common name for candidiasis caused by Candida albicans mostly. There's a couple of other subspecies that can cause it as well, but mostly Candida albicans, which is a commensal organism that can become more invasive, and it can affect the whole of the GI tract. So you get gastrointestinal candidiasis, you get oral candidiasis, oral thrush, and you also get thrush in the vagina and the vulva, all these moist areas. So as I said, it's a commensal organism, but it can be opportunistic, and it can cause an opportunistic infection if given the right situation where it can grow, certainly in the vulval and the vaginal area. So as you can see here, 3/4 of women experience vaginal thrush at some point, so it's very common, and some poor ladies have 1 in 20 women have recurrent thrush, so it comes back 4 or more times per year for them. And there are precipitating factors or predisposing factors for it. So it's common in young women in the age group 20 to 30. When people get pregnant, they're more prone to it. If you've got diabetes, you're more prone to it, and that's because when you have diabetes, you have higher concentrations of sugar in your cells and bodily fluids, and so that's a lovely growth medium for fungi. If you're immunocompromised or debilitated, your immune system doesn't spot it as easily, and so you're more likely to end up with thrush. And if you have antibiotics or immunosuppressant drugs at any one time, then they can also cause it. So antibiotics can change the normal flora of the vaginal fluid, and obviously immunosuppressants change that immune response and immune surveillance. So the symptoms of thrush. Obviously, they're local within the vagina. You don't really have the right receptors, but on the outside, around the vulva, you certainly feel an intense itch and burning, and it can get very sore because certainly people are a bit prone to scratching, and that makes it even worse. You can have a vaginal discharge, which is usually creamy white, very much like the pictures of the gastrointestinal and oral thrush that I showed earlier. Same sort of curd-like growth of candida. It can be watery though, sometimes thin and watery, and the really important factor is that it's odourless. So it can also cause pain and stinging on urination, and that's known as dysuria, and also pain when having sex because you've got some damage or inflammation inside the vagina and around the vulva. So those are the symptoms. We need to look out for certain symptoms to make sure that people who come with this condition are treated properly and sent to the GP rather than being dealt with just at a local level at the community pharmacy if necessary. So looking for your red flags. Firstly, if it's the first time that somebody's had this, just in case they've got mixed up with their symptoms, then you should send them to the GP to get a proper diagnosis. If somebody's had more than 2 episodes in the last 6 months, they should go to their GP because there might be some underlying condition which is precipitating repeated bouts of thrush. So they need to go to the GP for that. Under the age of 16 or over the age of 60, there are limitations on the licences for over-the-counter sales of the treatments. And so these people we would refer. And this can be for a number of reasons. So the licence is it's actually unlicensed for certain medications. All of the medications are unlicensed for under 16s except for the cream for outside use. And over 60s, it's unlicensed for them to have a capsule oral treatment, but they can use the intravaginal treatments, but only under the guidance of a doctor. So basically the situation is that we have to refer, and the diagnosis needs to be confirmed in this age group, as thrush is a lot less common in under 16s and over 60s, and there could be something else going on. And also there's the possibility of undiagnosed underlying causes. So in the under 16s this might be something like sexual abuse going on, and in the over 60s it might be that the patient has diabetes or has an immune suppressant, an immune disorder, and so this needs to be investigated. So in pregnancy, we don't give out treatments in general, and that's because, again, there's limitations on the licence, and also you want the GP to know about it so that they can review the patient, make sure they haven't got gestational diabetes, for instance. And anybody that has a previous history of sexually transmitted diseases, or has a vaginal discharge that's yellow or greenish or doesn't smell very nice, or has sores, ulcers, blisters around the vulva or within the vagina, needs to go to their GP. Now those questions, to find out those details, are very difficult to ask in a community pharmacy, and you would absolutely have to take somebody to the consultation room before going anywhere near any of those questions. But sometimes those are questions that you need to ask. So as well as that, if somebody's having various other symptoms which are not really related to vaginal thrush, such as abnormal or irregular bleeding, lower abdominal pain, pain during sex, or urination, or pain on urination, this could mean that they've got an infection. It might be pelvic inflammatory disease. It could be some other gynecological conditions as well as an infection, or perhaps as well as thrush, and they would need to be referred. And if somebody's already tried a treatment such as an over-the-counter treatment and it hasn't worked and they've come back for something different, then you would refer them, because it might be that they've got some other different condition. So the treatments that we've got available, there's quite a lot of different ones, but they're all based on the same principles. So basically most of the treatments are different formulations of clotrimazole. This is only used topically. It's not taken orally because it's too toxic, but it's very useful intravaginally. And what we always have to do when people come in, they might say they've got an itch down below, and that's an itch on the outside down below, because there are not the receptors to have the symptoms inside the vagina. But what is always the case is that it is always a vaginal infection, and so they will need to treat the infection at its source, which is in the vagina, and not just use the outside cream. And some people don't realise that, and they will just ask for the outside cream. And so anybody that does just ask for that, just check what they're using it for. If it's a guy, it might be for a skin infection. Same with a lady. You just have to ask that question, and then you can give them the right treatment for thrush if that's what the problem is, which would be an intravaginal treatment, perhaps as well as having the cream for the vulva and the outside. So these intravaginal formulations, as you can see, is a few different sorts. So pessaries can be just one that you use, and it's a 500 milligram dose, or you can use the 200 milligram strength and you put one inside the vagina at night for 3 nights. And these pessaries are used at night because otherwise if you're walking around with one in, it will drop out basically. So best to have gravity with you and while you're asleep at night, and then it will do its job the best and be in the place that it needs to be. So these intravaginal preparations are contraindicated, as said, for the under 16s, and there are precautions for use in the over 60s. And what's written in the pack is that you need to consult your doctor before using this product, and so that means basically we always refer anybody that's under 16 or over 60. During pregnancy, as I said, you would normally refer somebody when they're pregnant because they might have gestational diabetes, which would then could trigger off thrush, but these can be used during pregnancy, but as it says in this yellow box, only under the supervision of a physician or midwife. And during pregnancy, the pessary should be inserted without using an applicator, and that's to avoid damaging the cervix. So we do give these out, but you would always pretty much do it on prescription. And then finally, just to say, there's miconazole cream that can be used as well for vulval use instead of clotrimazole. Clotrimazole is in 1 and 2% cream form, but usually the clotrimazole products are supplied. So as well as clotrimazole, which is used topically just inside the vagina and externally in the around the vulva, you've also got fluconazole, which can be taken as an oral capsule. And this is very convenient. It's a one-off dose, just one capsule, usually a bit expensive, but they do the job just with a single dose. So you can also buy packs which have the thrush cream in with the capsule, which is Canesten Duo. These are absolutely contraindicated in pregnancy because the capsule, fluconazole, can cause birth defects. So you absolutely must not give it to anybody who's pregnant, and that means you must always ask. Anybody that's breastfeeding as well, they should not have this treatment. The drug fluconazole inhibits the metabolism of a lot of drugs by inhibiting the cytochrome C450 enzymatic system. And as you can see, there's loads of drugs listed there. So you need to know what medicines people are on before you provide this as a treatment. And just to say also that the fluconazole capsule and also clotrimazole 2% cream, which is the thrush cream, Canesten thrush cream, are also licensed for balanitis. And balanitis is where you've got inflammation of the foreskin and the head of the penis in guys. And this can happen as a candidal infection as a result of having a partner who has thrush. So just to let you know that you can give those out if needed for partners. Complementary therapies. So we've got some things that people want to try. So people want to bathe their genital area with diluted tea tree oil or plain yogurt, and that is not going to treat the infection because it's not in the right place, is it? It's not being inserted into the vagina. Some people want to use live yogurt internally inside the vagina. A bit messy. No, it would be pretty tricky to get the yogurt in there, but if they want to do that, they can. Yogurt's acidic, and it's usually got plenty of lactobacilli in it, and those will help with rebalancing the flora, but it's a bit messy. So people can give that a go, but it's just getting it to the right place is not so easy. And then there's also silk underwear called Dermasilk, and this is silk which has, as it says here, it's got a protein structure similar to hair, and it's woven into fabric, and then it's linked to antimicrobials, and these reduce the incidence of thrush. They're very expensive. It's about 30 something quid for a pair of pants. So not many people know about it and not many people want them, but occasionally somebody might come and ask you for them. So how can we prevent thrush from happening? Because some people, as I said, get this again and again. It's recurrent. So there are ways in which you can reduce your chances. So one of them is to have really good toilet hygiene. So this is when you go to the loo, make sure you use different paper front and back. One of the common problems that can happen is that you get contamination of fecal bacteria into the area of the vulva, and they will then contaminate the vaginal fluid, and that then alters the bacterial flora of that fluid, and then it doesn't work very well and you can get an overgrowth of candida. Another thing is to avoid chemicals and detergents that might remove the secretions from the vulva and from the lower part of the vagina and allow an overgrowth of candida. And those can also alter the pH of the secretions in the vagina, and so that then allows the overgrowth to happen. So make sure that people just wash the vaginal area with water, and that will settle things down. So another thing to do is to avoid wearing tight-fitting clothing and loose cotton underwear, because by using these things you then produce the right sort of conditions which are for fungal growth, which is a very humid and confined environment. So to sort of suggest that people just keep their clothes loose and cotton underwear. And then also to think about how you can protect the mucosa of the vulva and the lower part of the vagina. So if that mucosa gets damaged, then again it acts as a focus for the growth of abnormal organisms, And so make sure you can suggest to people to make sure they use a vaginal lubricant during sex, and then there's less abrasion. Or you can suggest using an emollient such as E45, any bland cream, or even Vaseline, so that that particular area isn't damaged and then leads to infection. So what else you can do, so especially for people who get recurrent thrush, where it's a real problem, some people end up with it every time they have a course of antibiotics. And so what you can do is to make sure that they have a thrush treatment ready and waiting when they start their course of antibiotics, and they can use it sort of after a couple of days of starting the antibiotics, or wait for the first sign of infection and then begin. So that because the antibiotics, what they do is they kill off bugs of all kinds, including the lactobacilli, which are one of the major organisms in vaginal fluid. Lactobacilli produce lactic acid, and that keeps the environment quite acidic within the vagina. And so obviously if you kill off those lactobacilli, you then get completely different organisms growing, and you can get this fungal overgrowth. You can also use Canesflor vaginal capsules, and these are capsules that are inserted into the vagina, and they have lactobacilli in them, and it's a particular strain that helps to create this nice protective barrier over the vaginal walls and to maintain this low pH. And you just put one capsule in at night for 6 days, and then use one weekly for 4 weeks, and that will prevent a bout from happening. And there's also something called Multigyne Flora Plus. And again, this is a right old tongue twister: galactorabinan polyglucuronic acid cross polymer, and prebiotics as well. And what this does is it produces the right sort of environment. It's an acidic gel that acts as sort of prebiotics, so food for lactobacilli, so it supports their growth and it suppresses candida. So again, that's a single dose of the gel inserted into the vagina every 3 days. And some people say, oh, well, I'm going to prevent thrush by eating live yogurt. And I think it's highly unlikely that that's going to work, if I'm honest, because you've got your bugs in the wrong place, haven't you? They're in the gut instead of being in the vagina, but some people want to give it a go. So the next infection that I'm going to talk about is bacterial vaginosis. So again, this is an infection within the vagina, similar to the fungal infection of Candida. And so it's a bit different in this is a bacterial infection, and it involves the bacterial flora changing within the vaginal fluid, and you get an overgrowth of a wide variety of anaerobic bacteria, and the pH rises, so it becomes more alkaline within the vagina. So the symptoms are different to thrush in that you've got a nasty discharge, which can be white, thin or grey, and it also smells quite horrible. So the very defining feature of this is that it's this nasty, fishy or unpleasant odour, and there can be irritation and it can be a bit itchy as well. But this is not a sexually transmitted disease. It's all about a change to the bacterial flora within the vagina. So what causes it? Similar things to when you've got candidal overgrowth, in that you're changing the flora, that microbial environment within the vagina. So one thing that can happen is that if you have sexual intercourse without a condom, you can end up with bacterial vaginosis. And one of the reasons for that is that seminal fluid is alkaline, and so it changes the pH of the flora within changes the pH of the fluid within the vagina, and that can then change the flora. For women who have menstruation or very prolonged menstruation, so particularly as women go towards the menopause, when they might be having lots of breakthrough bleeding, so they're bleeding frequently with menstruation, and that can lead to change in the flora within the vagina, and you can end up with bacterial vaginosis. And as with Candida overgrowth, changing your flora can happen because of your using soap and shower gels, using antibiotics where you've killed off your friendly lactobacilli and some other horrible bugs take their place, and use of intimate hygiene products and douching. So this is about putting various creams, anti-itch creams or whatever around the vulva, or frequent douching. which is spraying water into the vagina to supposedly clean it, but actually of course it's self-cleaning, and all you can do is harm by douching. So it changes the flora, and then you end up with bacterial vaginosis. So next we're going to look at the treatment of bacterial vaginosis. So if you went to a GP, they would give you either metronidazole tablets or the vaginal gel, or clindamycin. And these are antibiotics, and basically they would kill off the anaerobes which are causing the problem in the vaginal fluid. So that would be the first line treatment. But if somebody wants to try things which are a bit more natural rather than taking antibiotics, then you can also give them the option of using these gels which are available to insert into the vagina. And your choice is the Balance Active, BV gel or pessaries, or Canis Balance gel. And these are basically lactic acid containing gels with glycogen. It's very low pH, and that by reducing the pH within the vaginal fluid then discourages the growth of the anaerobes and encourages the growth of lactobacilli, and sort of rebalances the flora of the vaginal fluid basically. And then you've also got this multigyne acti-gel, which is very similar to the treatment that was used for thrush, with this galacto-arabinan polyglucuronic acid cross polymer, what a mouthful, and that helps to rebalance the flora as well by interfering with bacterial adhesion to the walls of the vagina and encouraging the growth of lactobacilli. So both of those can be used for treatment and are sold for that. So as well as that, there are things that you can do or suggest to anybody that gets bacterial vaginosis to prevent it from happening again. And all of this is similar to the advice for preventing thrush, because you're just trying to maintain that delicate balance of those flora within the vaginal secretions. So it's avoiding douching, which is vulval or vaginal washing. So using water to wash with, basically avoiding perfumed products and detergents, using a condom if people find that if they have sex then that encourages symptoms, because we talked about the alkaline nature of seminal fluid, and sometimes having sex can trigger this off even though it's not a sexually transmitted disease. So basically if they use condoms and they protect themselves. You can also use this Balance Active BV gel or pessaries, or the Multigyne Acti-gel, and you can also use Canis Flor, which are these capsules that you insert into the vagina which contain the lactobacilli to outcompete these anaerobes. So sometimes people don't know whether they've got thrush, whether they've got BV, or whether they've got trichomoniasis, which is a sexually transmitted disease, and obviously people would be pretty concerned about that one. And so there's a test that's available called Canis test, just to make you aware of it if you go into pharmacies and wonder what it is. And this helps to diagnose these vaginal infections. So it relies on the determination of pH of vaginal fluid, and then you also use the symptoms of the condition, and then you can decide what condition you have. So I've got a case study here for you, which I just thought you could have a look at, have a read, and then we'll go through the best treatment for this particular patient. Okay, so what is the best treatment for this patient? We've had a read already. So we've got a few different things. Make your choice. So really it was about making a diagnosis to start with. So that lady had basically symptoms of oral thrush and vaginal thrush. So no odour for the vaginal thrush. She got a sore mouth and white patches inside it. So both oral and vaginal thrush. And this is a real case. So this is somebody that came into my pharmacy. She also looked very tired and pale. And so just wondering if this is a lady in her 50s, whether there is a lot going on, and maybe there's a reason for her having both of these conditions at the same time. So a candida overgrowth orally and vaginally. So we could give a treatment which might help, but she absolutely needs to be referred, because we don't know what the cause of this is. It might be that she has diabetes. It might be that she has anemia because she's actually got an immune condition, and perhaps there's something wrong with her white and red blood cells. Just don't know, and it needs to be investigated straight away. So one of the problems in community pharmacy is that if you give somebody a treatment, sometimes they then won't go and get help from the GP, and that's probably particularly the case during the pandemic. So with this lady, I didn't give her anything because I wanted to encourage her to go straight to the GP. So it was just to refer. But if we'd given her a fluconazole capsule and the 2% clotrimazole cream, that might have helped both the oral thrush and the vaginal thrush as well. But I avoided doing that because I wanted her to go and get seen by the doctor. So to refer would be the best answer. Okay, next infection, cystitis. So what's this about? So it's inflammation of the bladder, usually because of a bacterial infection. I've got a nice little picture there of the kidneys, the ureter leading from the kidney to the bladder, and then from the bladder to the outside of the body via the urethra. So that's how urine gets out of the body. So bladder infections, so this is an infection in the urine, can be caused by not emptying the bladder properly, so it's still got some urine in it most of the time, and that then gets infected. Damage or irritation around the base of the urethra at the outside of the body, or bacteria transferred from the anus to the urethra, and then those then go up the track up the urethra and get into the bladder, infect the urine. So it's more common in women than it is in men, because us ladies, we've got a short urethra, and the opening of it is very close to the anus. Of course, men have a penis, and that gives them a much longer urethra, and also means that the end of the urethra is a long distance from the anus, and that protects men from a urinary tract infection. Of course, when they do get one, it can be very serious. So it's common in sexually active women, those who have pregnancy, and women who are post-menopausal for various reasons. So sexually active women will have disturbance of the urethra, and there may be bacterial ingress from having sex. In pregnancy, sometimes you can get gestational diabetes, so the urine becomes quite full of sugar. And also in pregnancy, you've got pressure on various organs as the baby grows, and so women can get infections. And then postmenopausal women, they can end up with some damage to the urethra because of the lack of estrogen. It isn't maintained quite as well, and that means that they can end up with infections. And as you can see there, common bacterial species include E. coli and other bugs, which are usually in feces, and that's because of this short distance between the urethra and the anus with women. So some other precipitating factors, so diabetes, as I said, sugar in the urine, that's a nice growth medium for any bugs. And then it's using toiletries such as bubble baths and deodorants and other chemicals like spermicides, which might then strip the area around the base of the urethra of the sort of natural protectants, and that damage then causes infection. And medication as well, cytotoxics such as cyclophosphamide, you're reducing the turnover of cells of the urethra, and also cyclophosphamide itself can be quite aggressive on the bladder cell walls, which causes some infection. So symptoms of cystitis: frequency, which is going to the loo a lot, so wanting to go for a wee a lot, and urgency, so that's where you not only want to go a lot, but you have to get there really quickly to the toilet for a wee. So pain or stinging during urination, called dysuria, pain in the bladder, and cloudy or strong smelling urine because of the bugs growing in it. Sometimes there can also be blood in the urine from infection. infection, and that would be quite severe. So these are your red flags where you'll want to refer the patient straight to the GP and not deal with it yourself. So if somebody's having cystitis symptoms for the first time, you want to refer them to make sure that's what's the matter. Hematuria is blood in the urine, or if the urine's very dark or very cloudy, then you would refer, because that could indicate quite a severe bacterial infection. Fever, temperature more than 38 degrees, vomiting, loin pain. Loin pain occurs, and vomiting usually when you've got kidney involvement. So not only is the bladder infected, but also the infection has tracked up the ureters and may have got into the kidneys, and that's why you need to refer. So, and also fever would indicate that this is really a systemic infection, which is quite bad. More than 3 episodes a year, you would refer, because there might be a reason for that needs to be investigated. If it lasts longer than a couple of days, you would need to send somebody to the GP, because that's a more serious case of infection. And if they've tried the over-the-counter treatments already, then you would refer. Pregnancy and men or children, you would definitely refer, because with those, investigations need to be made to see what the cause is. And as I said, with men, usually it's more serious infection which can track up to the ureters to the kidneys, and they would be given a longer course of antibiotics to clear it up. So anywhere where you need to be giving antibiotic treatment, which would be pregnancy, men and children, then you would be referring. But we do have one sort of treatment that we can use over the counter, and a lot of people take these and find it effective for mild symptoms only. So this is just for a mild infection, usually with somebody who doesn't have a lot of other pre-existing conditions, so young women. What you can give is alkalinising agents. And what these do, so these are sachets of either sodium citrate or potassium citrate with some other things in there as well, flavours and whatever. Make a drink, it's a nasty salty flavour usually. But these sachets of salts of sodium or potassium citrate make the urine more alkaline. That then reduces the irritation in the bladder walls and the urethra, and so that then reduces the intensity of the symptoms that are being experienced. And then the patient gets better themselves, their immune system kicks in and gets rid of the bacteria on their own. And you usually, as well as that, you would then usually also give advice to drink plenty of water to flush out the bugs, avoid alcohol, coffee, strong tea or fruit juices because they're acidic, and to avoid sex until your infection is cleared up. You can also give paracetamol or ibuprofen if they're suitable for that particular patient, which help with the pain, if the pain is one of the bad symptoms. So these alkalinising agents, and I showed you the brands, cystopurine and Cymolon, a couple of the brands. So depending on the formulation, whether it's a sodium-based or a potassium-based alkalinising agent, then there are quite a few contraindications. So you wouldn't want to give these to anybody who's got heart disease, who's pregnant, children, men, those with hypertension, and also older patients. So anybody over 60 you wouldn't want to give these to either. That's because people who are older are generally on lots more medicines, and also they may have undiagnosed hypertension or heart disease, and you just wouldn't want to give them to anybody who was older, and they're contraindicated in those over 60s. So basically there's a lot of people who can't have these. As I said, it's usually younger patients that you give them to. They also interact with a number of drugs, so sodium salts interact with lithium and can cause people to go into toxicity without that. And there's then the potassium salts interact with a lot of medicines, which is certainly plenty that you have hypertension and heart disease. So your ACE inhibitors, your ARBs, your potassium diuretics such as arylide, and your aldosterone antagonists such as spironolactone. So all of those medicines interact. So whether you have if you have somebody that has hypertension, and whether that's and they have a urinary tract infection, then you wouldn't want to give either the sodium or the potassium containing sachets, and you would refer them to their doctor for treatment. So if somebody gets cystitis quite regularly, unfortunately some people do, then there's a few things that you can suggest to reduce the chances. So firstly, ensure they're drinking plenty of water, and always make sure that when they go for a wee that they empty their bladder every time, so not rushing things. And when they go to the toilet for number 2, so after defecation, to wipe the front to the back or to use different paper. That's to reduce the chances of transferring bacteria, fecal bacteria, to the urethra. They also could urinate after sexual intercourse, and this reduces the bacterial load and sort of washes the lower part of the urethra clean after sex. And then some people want to take cranberry juice or capsules, and there is some very limited evidence to say that compounds within cranberry reduce the adherence of bacteria to the cell walls of the bladder. So some people do take those prophylactically. There's no evidence that it helps with treatment, but some people do use them successfully to prevent cystitis if they get it frequently. So we've been through a few infections there. We've talked about vaginal thrush, bacterial vaginosis and cystitis, and so there are a few other treatments that we've talked about in the part 1 lecture, which was dysmenorrhea, menorrhagia and premenstrual syndrome. And so what I've got here is some a way to try and get you to think about all the different treatment options that we've suggested, and decide when somebody comes in with a condition what you would suggest for them to be treated. So if I can leave that with you, if you have a look on the slides, which are fixed slides if you want, and try and decide which are the best treatments, and then I will set up a separate slide for you to have a look at the answers for that particular question.